Well, the North West Health Department is rolling out an outreach program at the Westvaal Hospital in Matlosana, and this is for former mine workers. The program aims to provide the former miners with a service to claim for their unresolved benefits. It's part of government's efforts to ensure that the ex-mine workers and their dependents who qualify for compensation are paid. The benefits include pension and provident funds for contracted occupational health diseases. To date, millions of rands have been paid out to qualifying beneficiaries. And Newzroom Afrika's Refiloe Seboko is following the story for us and joins us now. Refiloe, good morning to you and welcome. Without these benefits, it really is a terrible plight that faces mine workers, specifically ex-mine workers, in terms of accessing money and health care.
It sure is, Imani, and that's why we're seeing that today the Deputy Minister of Health is Newzroom, together with MEC of Health in the North West Province, Madoda Sambatha. They are here in Westvaal Hospital in line of that outreach program and the progress that has been made in terms of tracking and also paying those ex-mine workers. But let's welcome MEC Madoda Sambatha to talk to us, MEC, about this outreach project. Thank you so much. Welcome to Newzroom Afrika. Explain to us about what today it's really all about in this outreach program.
Thank you very much. It's a program driven by the National Department of Health, led by the Deputy Minister, Dr. Seboko. Of course, a program out of a unit of the National Department of Health responsible for compensation of occupational health and safety diseases. And this unit is responsible for compensation of ex-mine workers whose exposure was at workplace and whose exposure was on occupational diseases. Majority of them had left the industry without claiming, and the reason being that most of them, when they leave, the process of check-up is not properly coordinated, and it is discovered later that most of those that would have been exposed by the occupational diseases would have gone home or died without having claimed their compensation back. And the compensation responsibility for occupational health diseases rests with the National Department of Health. On the basis of that discovery, then the decision is that the provinces must work with national to trace and track those that might have left without check-up for them to be checked, those that might have left without claiming their compensation, so that when they qualify for compensation, they are compensated. A practical experience would be that someone who has left a mine 10 years ago and never checked up or was never compensated, as we speak now, that person is accessing a public health facility on the basis that the person does not have money, yet money is due for the same person from compensation unclaimed. That's what we are doing as a Department of Health, both province and national.
And in the province, how much progress has been registered in terms of tracking, tracing and paying these ex-mine workers?
Well, the last time we did have an assessment, we discovered that more than million was already claimed. What you have is that there are members who reflect as being active with bank accounts. When you know a person is active with bank account, it's not difficult to trace that person. But there are members who do not appear being active on bank account, who appear to be due for compensation. It takes time to trace them. And tracing is meant to then link them with the money that they have. Whenever you have a person receiving a payment, it's on the basis that it is confirmed that the person indeed had contracted an occupational disease. But what we must call on mine workers, like me, I checked myself first because I'm an ex-mine worker. I was cleared that I'm not owed by any chance either injuries or occupational diseases, and I accepted that. Mine workers must accept that not all of us are due for payment. Only those that would have contracted occupational diseases, who when checked is going to be discovered that yes indeed, so and so had initially contracted an occupational health disease and is due for compensation. When you are checked, when we call you to come for a check-up, we are not indicating that you are technically owed. We are checking to be sure that you did not contract an occupational disease and you are not owed. So not all of us as ex-mine workers are owed. Mine workers must stop mobilizing on the basis that once a mine worker always owed and always contracted occupational health disease. It's not like that. It's those that are proven by check, and those that when you link them with the system, you discover that indeed they contracted an occupational disease and indeed they never claimed and they are due for payment. So the work is not based on the fact that each one of us must be owed. It's based on the fact that all those that qualify and had not been compensated, we must bring them to be checked and be compensated.
And what would be the requirement proof of document that says these are those that do qualify, or the process in which mine workers or ex-mine workers need to follow to check themselves?
Remember, working in the mines, you would have your number of the clock system. You will also have that number appearing in your documents of the mine. But what then happens is, in case I passed on as the one who was working in the mines, then my family brings my documentation to be the one that I check. Then historical records of me, of medical health checkups, are then used as a basis to check whether I had contracted and in time of getting in and out of hospitals, there was anything that was recorded of a sign of me contracting an occupational health disease. So, meaning it's live and those that have passed on, but with contraction or with family having traces of that, then you use that. It's your TEBA documentation, it's your mine number, it's your ID. You bring them as a proof. On this system, again, we must call on ex-mine workers not to be robbed. It is not done for purposes of taking money. Nobody does it with taking money up front before helping you to claim. That's why Department of Health is doing it as a department for free of charge. We even transport them for access to where we are checking them.
Thank you so much for your time. MEC of Health in the North West Province, Imani, closing it off there with the required documents for ex-minors that needs to be checked on whether they do qualify to be compensated.
Refiloe, Seboko, thank you very much for that critical update. A number of families' fates are at stake here. So you've heard the information, you know how to get in touch. Please do so.